struggles to address the threat of COVID-19, there is still no consensus on an optimal medication. Our global scientific community is scrambling to keep up with the daily influx of overwhelming information. This can cause misinterpretation and misinformation to spread, which is harmful to the public. For example, Trump's endorsement of hydroxychloroquine was not evidence-based, but its demand spiked. This showed us firsthand what can happen when clinical decisions are not based on evidence.
Trump's endorsement impacted our community's safety by contributing to drug shortages and exposing patients to potential side effects such as heart rhythm problems. As a group of recent pharmacy graduates and students from the University of Toronto, we started the COVID-19 Drug Evidence Initiative because we saw the need for a concise and accessible resource for healthcare providers to navigate the tremendous amount of drug-related COVID-19 literature that is published daily. Our mission is to create an accessible and trusted resource with updated summaries and critical appraisals of all randomized controlled trials for COVID-19 drug therapies. The CDEI team assesses all emerging literature on COVID-19, then delivers only the relevant evidence to you.
Traditionally, as research is completed, it is published in a scientific journal that healthcare professionals use to inform their care. This information has been cumbersome and difficult to access for healthcare professionals. Difficulty was only magnified with the onset of COVID-19. Our infographics provide a quick assessment of the trial quality and context. These can be found on both our website at cdei.ca or COVID-19 DEI on our social media platforms. COVID-19 still remains a long-term threat as there is a rising number of cases globally and no current vaccine. With no consensus on treatment and rising outflow of publications, CDI will help to reduce information overload and inform evidence-based practice.
We are My Digital Waiter, a full-service POS system focused on contactless ordering. We aim to help the hundreds of thousands of restaurants across North America navigate their reopening and help build for the future. Contactless ordering, which allows customers to order and pay through the convenience of their own smartphones, has shown to increase table turnover, decrease labor costs, and increase average check size. This has been the standard in Asia for many years, and the headwinds of COVID has created the opportune time to bring this technology to the forefront of the North American dining experience as restaurants struggle with balancing costs and limiting staff to customer contact. My Digital Waiter is a unique web-based cloud platform where dine-in restaurant customers can easily scan a QR code or go to our website and enter their unique table code to order. No app installation required. From there, they can enter their information for contact tracing in compliance with evolving local regulations. As they say the menu, it is a zero learning curve experience. The user flow is identical to online ordering apps such as DoorDash and Uber Eats, where customers are prompted for selections and can write in custom instructions. We are fully integrated with Stripe, allowing customers to pay in-app with all major debit and credit cards, including mobile wallets such as Alipay and WeChat Pay. On the restaurant side, we have created a full-service POS system with all the critical features and functionality of other leading POS providers, including kitchen chip management, sales records, and contact tracing. We plan to disrupt our grossly overpriced competition through a freemium model, with upcoming paid features such as reservations and analytics.
Hi, my name is Isaac Joshua. I'm from Nigeria. I emerged as the first position winner in the Beyond COVID-19 Community Challenge. I'm the initiator of the solution RACE. RACE is an acronym which stands for Rural Agricultural Input Scheme. RACE is an app which seeks to offer services to rural farmers in need of farm inputs, loan schemes, as well as other capital-intensive agricultural activities. As a result of the COVID-19 pandemic restriction posed by some farmers in localities and communities, it has hampered them to have limited or no access to markets. There's a delay in the purchase of various farm inputs as well as equipment for cultivation. With the introduction of the RACE app, This will mitigate the effects of the pandemic on food production through the provision of its services, such as place and order future, capital-intensive resources, pre- and post-farming techniques embedded in MP3 and video formats in several languages for downloads. Overall, RACE app seeks to ensure that rural farmers have timely access to farm inputs, modern farm techniques, and enhanced product delivery. Finally, I believe this is needful for the pre- and post-COVID-19 era in order to increase food production and timely access to farm inputs, and to curtail the effect of hunger, poverty, and food insecurity this year and the year to come towards the attainment of the 2030 SDGs Goal 2, Zero Hunger, and SDGs Goal 11, Sustainable Cities and Communities.
Hi Walid, it's Tafazo from Dawa Health, an AI-powered digital health platform that's empowering mothers to receive remote and maternal health. So we started early last year when my cousin became pregnant, and we realized how difficult it was for African mothers to access good quality antenatal care, putting at risk of developing pregnancy complications. So can you imagine that more than 79% of mothers in our target market don't have access to good quality antenatal care? That's more than 5 million mothers over the next 5 years. It's unacceptable that 13 plus mothers are dying daily from preventable pregnancy complications. We felt the plight of all these mothers and my cousin, and that's how Dow Clinic was born. So we are providing a digital health platform that's accessible via a smartphone app. A chatbot uses the SMS app for mothers to get the information they need to make informed decisions, but at the same time get support from community healthcare workers who are midwives, nurses, and rural-based community healthcare workers. But we also provide these community healthcare workers with a kit that allows them to support the mothers. So with the kit, they're able to look at things like pregnancy-induced high blood pressure, pregnancy-induced diabetes, and urinary tract infections way early and intervene that early. So our business model is quite simple. We're charging mothers $2 a month to get this support from community healthcare workers, and community healthcare workers get 70% of that. Why we chose that model is because it's easily scalable and it lowers down our marketing cost, because the community healthcare worker are getting a larger chunk of the income, so they'll move around to onboard more mothers into the platform, and we'll make most of our money from pushing ads from vendors who want to target this community of mothers we are building. So that's why we chose that model. So I work together with an amazing team. Together with over 20 years combined experience, ranging from computer science, medicine, business admin, and finance, and with a very strong advisory board of gynecologists and obstetrics and tech specialists or co-founders of Bongo Hive Innovation Hub here in Zambia. So there are other companies who are trying to solve a similar problem, but our competitive advantage is we're leveraging community healthcare workers. Our system is multilingual, and we're providing remote maternal health. We are delicately, so our financials, we're looking to grow our system to 30,000 mothers in the next 12 months, and that will generate about $100,000 in revenue. And so Dawa Health essentially is a digital health platform that's empowering mothers to receive remote maternal health, or contributing to SDG number 3 and 4. Thank you.